End of life is a very difficult period to deal with because it is very emotional event, and it can be very difficult for the patient, their relatives, caregivers, as well as their doctors, nurses, healthcare professionals. What do we do in the end of life situation? How do we deal with questions which are being asked? How will I die? What will happen after my death? What will happen to my body? What will happen to my soul? A lot of spiritual questions might be asked. Will I die of pain? Will I suffer? So, a number of questions are there which are very, very difficult. One thing we should probably keep in mind is that all these questions do not necessarily have to be answered like a question and answer. We take this opportunity to allow the person to speak about their fears, their thoughts, their concerns, their wishes, and what all is going on in their mind. Also, many times there might be religious questions, spiritual questions. Now, of course, we don't know what will happen to soul after a person's death, other than what we have read from our, books and what we know from our traditions and other things. So, end of life care in communication involves allowing them to talk, reassuring them, cutting down on their fears, if they have any myths and perceptions, to control those. There are certain things which can be controlled. For example, pain. We can provide pain relief. If they have distressing symptoms, we can provide relief for that. If they have sleep disturbance, it can be helped. If they have psychological disturbance, that can be helped. If they have spiritual distress and concern, that can be helped. Taking care of a person in an end of life situation can be very, very satisfying if it is done in the right way. And that depends on if the person who is in end of life feels satisfied, it should be satisfying to you.